Hello all, Dylan Roberts here again, just talking to Paul Marchant about this weekend's WPAS rollout. So we're just going to do a short video where I'll be asking a couple of questions so I can understand where we are this weekend, and in particular what the impact's going to be on the teams, so everyone knows what's going on. So Paul, what is going on this weekend for the WPAS rollout?
Well, I mean, first of all, it's a combination of 3 years of significant effort. I mean, obviously with a pandemic thrown into for good measure, but has got us to this weekend. So if I talk through the sequence of events, on Friday, we set up the coordination centre and hold a couple of assurance meetings with our services. Around 5 o'clock, we switch off PIM system, and then our West colleagues invoke their business continuity and downtime procedures. Okay. Then we start a 48 hours worth of data migration activities against this detailed cutover plan that we have. On Saturday, we have checkpoint calls with operational managers, and we provide updates which are, whilst the data migration activities continue. We come to Sunday and assume that everything's gone to plan. We should be able to hand the environment over sometime in the morning for our internal testing teams to start doing validation of the data migration, as well as some of the user acceptance testing. Around lunchtime, this is on Sunday. If all is good, we then open the at lunchtime, late afternoon, we open the environment up to our services as well as the team to start doing final testing. Then we can start transcribing the admissions, discharge transfers, theatres, listens, and update things like the maternity. So this gets us to the point where the system is good to go live. Okay, so at that point, hopefully our team go away and have a good rest and a good sleep, and then we hit the Monday morning. So our support team arrive on site about 7 o'clock. We do our final preps and tests, and then we go live with the system at 8 o'clock with our clinical operational team. I mean, the key things to mention there is obviously at go live, we're managing it as a major incident. So we're very much at the direction of the hospital director, Barry Williams, as well as rotated managers who are going to basically direct the team where to support, to ensure that we can continue the provision of patient care, and obviously ensure that patient safety is maintained, which is paramount to the success of the project as well.
Yeah. So what you're saying is then ultimately, the service will be running on paper via the business continuity arrangements from Friday straight the way through to the Sunday, and then we switch over 8 o'clock on the Monday morning. So what teams are involved in that then?
Well, it's a real team effort. So it's multi-team, multi-organisational efforts. So if we just break them down, you've got your core team of information project staff. And I mean, there's too many people, to mention, so we'll try to class them into groups. But you've got your information trainers, your WPAS team specialists, data migration specialists, testers, and wider information team support, with a project wraparound, which is good. And then we look at the wider informatics team. I mean, this is, again, a whole informatics department's involved. So you've got your ICT, your integration, your health records, and your coders. And they support in activities like your printing, your infrastructure, your integration, your clinical system validation, again, absolute key, as well as setting up the training rooms and coordination centres. So a real team effort across the board. We look at the suppliers. So you've got, again, a significant number of DHCW colleagues who are involved in the implementation of this WPAS system, as well as supporting so the go live period. And then Daedalus, the PIM supplier, heavily involved in data migration, and as well as setting up the read-only PIM system, which becomes our archive. Yeah. But obviously, you've got to also look at the services. I mean, we've had really brilliant and positive engagement from our West service management and staff, and brilliantly led by Barry Williams, the hospital director. And finally, senior management. This is all made made possible with informatics S&T. Your senior.
You have to say that though, don't you?
Yeah, unfortunately got to throw that in for just for good measure. And your senior reporting officer Neil Rogers, absolute paramount, in leading and directing this project. And finally, we've had a lot of engagement from hospital directors and management in Central and East, because it's, we're pouring West into Central, and also looking at standardisation, ways of working with our East colleagues as well.
Yeah, no, it's brilliant. I have to say, I mean, I know I've only been involved for the last month or so, but the prep work that has gone into this is very impressive and very comprehensive. So hats off to everyone who's been involved in that. And I guess to some degree, what you're saying is ultimately you know, we might be a bit weary-eyed, but this is the final push this
Well, it
weekend,
is.
and I guess the next 2 weeks is the final push. I mean,
Yeah.
how do you feel about the whole thing?
I mean, I feel incredibly positive. You know, I mean, as I say, this is you know, it's been a hard, you know, massive amount of effort. You know, 140 people you know, have been involved. You know, 140 people, yeah. And you know, this is obviously significant input. You know, into this project. Additionally, you know, the team. Sorry, I've just lost my trail of thoughts. Apologies there for a second. The Sorry, my son has just pause it for a second, darling, if you can. Please go upstairs. Please go upstairs. Please go upstairs.
You have to go to the room